medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
The autonomic nervous system is pretty much responsible for everything done for you at a subconscious level. And that means your breathing, blood flow, sweating, blood pressure, pancreatic function, etc. 9 out of the 10 causes of death are either initiated in the autonomic nervous system or they complete in the autonomic nervous system. That's how important this nervous system, once studied in the first or second week of school, is coming back to hopefully help you with patients. The one thing that does not, of course, is trauma, because it is a sudden thing, so that is not initiated nor completed in the ANS. Hi, I'm Dr. Mitch Ghen, and thank you for joining me today. And today I want to talk to you about a specific component of the autonomic nervous system. It is called the pseudomotor function, as well as one other piece, which is called the very low frequency of the ANS. Now, in both cases, these that are tested and found to be positive can reveal the presence of a potentially lethal issue. It's often overlooked by the conventional physician. And the typical diagnostic tests, such as lipid panels, EKGs, stress tests, and even echocardiograms, cannot diagnose this problem. Now, you're probably saying, okay, what are you referring to? And the answer is the microcirculation, being embarrassed, which, by the way, happens to be the cause of 46% of heart attacks, and yet it's only diagnosed by the use of an autonomic nervous system type machinery, occasionally from a little instrument that's a bedside skin microcirculation evaluator, or sometimes even perhaps an astute practitioner that can see the ocular changes from an ophthalmoscopic evaluation. There are 4 specific types of individuals that have the majority of microcirculation complaints and abnormalities. These include males, diabetics, smokers, and those people with chronic stress and anxiety. And I guess that's pretty much all of us. These terminal areas, or the microcirculation of the vascular system, they can't be bypassed. There's no stent that you can put in because they're the size of a hair. There's no balloon angioplasty that will help this particular problem. Drugs like statins, well, they're not effective in these type of patients. And typically, these folks show poor overall autonomic nervous system functioning to begin with. Now, you can get a hint of this problem, even if you don't have the machinery yet or don't use it currently, by ordering a simple blood test, which you're probably all familiar with, which is known as fibrinogen activity. If the fibrinogen activity is around 250, that's optimal, but anything that begins to get above 300 should begin to make you suspect of a microcirculation problem. Often people know that the elevation of fibrinogen means that the blood is more viscous. In this case, it's also a difficulty with the microcirculation. Further autonomic testing with a autonomic machine seems to be reasonable after seeing a fibrinogen level that is elevated, but the most important thing, by following this small area, you'll be able to save the lives of hundreds of your patients. And in the next episode, we'll talk a little bit about how do you treat something of this nature. In the meantime, if you have any further questions, go to drmitchghen.com. That's drmitchghen.com. Thanks for joining me today.